Audio Jungle.
Over the years, the Nigerian health system has suffered huge setback due to poorly equipped public hospitals. This has affected the masses, particularly in the rural areas, as a result of economic inequality, bringing about the brain drain and medical tourism currently experiencing, as the plea for reasonable pay of doctors and nurses by the federal government fell on deaf ear, necessitating the commitment of private facilities such as Alliance Hospital to provide quality healthcare delivery in the country. However, since its operation from 2011 to date, Nigerians could attest to their wealth of experience, professional conduct and equipment, with the primary focus of tackling medical tourism in the country. To this end, the FCT Guild of Medical Director and the leadership of Nigerian Patriotic Youth Against Corruption and Transparency Initiative, in recognition of this commitment to reverse medical tourism in Nigeria, are here in a solidarity visit and with a presentation of Integrity Ambassadorial Award to the Managing Director of Alliance Hospital, Dr. Christopher Otabo, aimed at encouraging him on the path of saving lives.
The burden of kidney disease in this country is very high and alarming, and there is need for proactive ways of managing kidney disease. In that regard, we are here, two executives from the Medical Director of Solidarity
We are today extremely happy at this premise of understanding that we are right before a man of excellence who has given so much to the empowerment of youth in our dear country. An indisputable Nigerian flag waver, a quintessential leader of a quintessence of good leadership, whose didactic personality is a pedestal upon which the vision of our land can be realized. We are not ignorant of the unblemished record and antecedent of Dr. Christopher Otabo, a man whom has been friendly and have empowered the youth because he found solace in them. Your unadulterated value of humanity, hard work, integrity, and utmost of all patriotism has been our source of motivation and moral upbringing. As we ably understand that, we must call for people of your kind for more development to come to our nation. We want to assure you, sir, that the Nigerian Patriotic Youth Against Corruption and Transparency Initiative is strongly in support of you and your activities and shall always stand by you.
Responding, the Medical Director of Alliance Hospital, Dr. Christopher Otabo, commended their gesture in honoring him with an award and called for more investment to tackle the unprecedented medical tourism and brain drain that has affected every aspect of the economy.
The private sector, more needs to be done to encourage the private sector to do more. We cannot be deterred. We must continue to work to save lives because that's the primary thing. Healthcare professionals gravitate towards those that know their value. If you're not going to treat your healthcare professional very well, if they have the next opportunity, they're going to leave. Yeah. Yes, they will. And how do you treat the healthcare professional well? Is by investing in the healthcare system. There are strategic investments. Good salary is one of the motivating factors for doctors to stay back. That means you have to have the equipment to save those lives. When you are in the hospital and you are confronted with the patient is bleeding and you don't have the equipment to stop his bleeding, and then you watch that patient until the patient bleeds to death, not because you don't know what to do, but because you don't have the equipment. Throughout that week, you will never be the same. It will take a lot of guts and courage for you to come back to yourself, because you see yourself as a failure. That is one reason why Nigerian doctors are leaving. Because most of our hospitals are not equipped. So they don't have fulfillment.
The Managing Director also lamented the doctor-patient ratio and urged for measures to break the inequality gap in the country.
Today, our doctor-patient ratio is more than 10 times higher. If anybody tells you that we have one doctor to 6,000, that is an overestimation. we're talking about 1 doctor to 10,000 Nigerians. And another problem with the ratio is not just that the ratio is very high, but the fact that there's inequality. There's inequality in terms of the distribution. There are some villages, you don't even have anybody. You don't have 1 doctor in the whole local government. How are they going to survive? So the way it is for doctors, that's how it is for nurses, that's how it is for radiographers and other healthcare professionals. We cannot continue to pretend as if it doesn't matter, because it does matter. The government can do more to bring that to health act, because that's like the dictionary of the healthcare system in the country. If we address all this and the brain drain stops, it will not only stop the brain drain, it will also reverse medical tourism, because both of them, they work hand in hand. Because if we have equipment, the doctors will stay. And then, so what would the patient be doing outside? They will also stay. So with all this, and the private sector taking their place, because actually, the private sector is doing a lot to stop medical tourism now, perhaps more than the government hospitals across the country. If you are going to do an open heart surgery in this country now, as things stand now, let's say it's an emergency and you cannot go abroad, you can only do it in the private hospital in this country.
The event saw the light of constant commitment to the health and well-being of the citizens. Vincent Okushi, reporting for Quality Television.
Audio Jungle.